Today, we have the privilege of catching up with Robert Linde. He will be teaching a specialty class at the 2023 PESOMA Acupuncture and Asian Medicine Conference on Friday, August 25th at 2 p.m. The class is called Unique Herbal Medicine Approaches to Orthopedic Issue. Hi, Robert. Thank you for talking with us today.
My pleasure. I'm looking forward to the conference, as always.
Wonderful. So can you tell us what inspired you and led you to create this class?
Obviously, one of the big focuses for my practice is always herbal medicine. And when people think about orthopedics, they rarely think about reaching for their classical formulas or Western herbs or an integration of the two. And for me, I always look for the least invasive way that we can approach both acute and chronic orthopedic conditions, and to expose people to how we can manipulate the classical formulas to address specific issues, a little bit of diagnostic review that's vitally important if we're going to use herbs in an orthopedic or any condition, and ultimately talk about some of the really special Western herbs and how we can bring those into our classical formulas for specific issues.
That's wonderful. So what is the clinical application of this class that you will be teaching?
Of course, orthopedics and pain is the bread and butter of every acupuncturist. But too often, especially in those chronic conditions, we're not able to have the long-lasting results that we want sometimes. There's always those 10 or 15% of the cases that just don't get the progress, that they're coming back every week and not holding. That's where herbs can both speed up the progression of their wellness, as well as addressing some of those really complex patterns that can be a challenge. So my hope is that every person who has the opportunity to take this class starts using these herbs, the formulas, the adjustments, and even some of the liniments that I hope to introduce to everyone so that they can get better outcomes in all of their complex issues, as well as some of the acute problems that we see in clinic.
That sounds so interesting. Make me want to take this class as well.
But
anyway, absolutely. Okay, so moving to the next questions, what are the benefits of taking your class?
Well, I think I always have a great comedy routine. No, actually, I always really feel like I have some folks who really are trying hard to incorporate herbs into their practice or looking at how they can best utilize herbs. So for the folks who are able to take that Friday afternoon class, it's going to expose them to herbs that maybe they didn't learn in school, because I always include some of the Western herbs. I also talk about some of those really commonly used Chinese herbs that we have easy access to, but introduce some new applications that you may not have thought of. In particular, things like when we're looking at Polygonum multiflora, Yuzhu and Huangjing, one of those we can use as effective, if not more so, than the Western Solomon seal for specific tendon issues. So really start to open up people's exploration of unique herbs, the Chinese herbs that we already have access to, but also make them aware of some of those Western herbs that have phenomenal benefits that belong in our Medica and will increase their clinical successes that we all are looking for.
Outstanding. So finally, could you describe a case where you had the best success using the knowledge of unique herbal medicines approaches to orthopedic issues?
It's always so hard to choose something like that. It's easy to pick a few miracles, but I'll give you one of my favorite examples. There's an herb in Western herbal medicine called mullein, and most people learn about the leaf of that and has many applications to nourish the lung yin. But through one of, I'm going to say my teachers on a fairly informal basis, Jim McDonald, who lives up in Michigan, introduced something he learned from the Ojibwa people up there in that upper peninsula about using the root of mullein. And it's specific for helping to align the spine. And it's very hard to find it as an herb of commerce. Usually you have to harvest it yourself, and it grows here in Florida as well as honestly throughout Europe and much of the US. So I always keep a single tincture, an alcohol extraction of the root. And I can't even remember the number of people I've had come in who have some sort of misalignment of the spine. I've used it for bulging discs. But one of my favorite cases, because I talk about this herb a lot and nobody really believes me at how fast and effective it is. I had one of my externs from one of the local acupuncture schools who was there externing with me, and she had chronic issues, scoliosis, that really made her almost in chronic pain all the time, and was certainly doing all the right stuff, but scoliosis is tough. Not to say this will cure scoliosis. But she came in one day for one evening to work in clinic and was struggling. She was having a hard time focusing on her patients because of the amount of pain, and she was kind of bent over, with that contraction. And I was like, I just came back from an herb conference. When I harvest this myself, I always try to harvest plants fresh when I'm able to. And the tincture was ready. I was like, I know you think I'm crazy, but give it a shot. And so she was like, all right. And I gave her one dropper full of the tincture, and she kind of like scrunched up her face a little bit because it tastes bad. And then you just saw this almost confused look on her face as she actually straightened up within about 2 minutes. And although there still needs to be work done, the ability for her to get on the table, to get her own success, to make it through that night, not in chronic pain, really made this such a powerful and fast herb that can be used in formula or single. And one of the things when any of us have that person who comes in, they're excruciating pain, they're not sure they can get on the table even for us to do our work. The ability to give them a tincture of this, just as we're doing the intake, like we already know that, like, okay, you hurt your back, is some kind of subluxation, a misalignment or a bulge in the disc. I'll literally say, give me 1 second, I'll grab a bottle of that, and I was like, throw it in their water and let them drink it. And they're able to get enough relief from that they're able to get on the table. And I'm going to say I've had that happen 50 times that I've utilized that. Regularly add the mullein root into people's classical Chinese formulas, as well as sometimes into a Western herbal formula, and really makes the job easier when half the issue's done. Now we can open up the meridians, we can relax a few muscles that have spasmed for the body to protect the low back and the lumbar and sacrum. So it's always fun when you just watch that confused look as the magic of herbal medicine takes over within seconds, if not minutes.
That's fascinating. I know exactly how the expression is, and I think your case study is very relevant in today's world. And I'm excited to meet you in person in your class. So thank you so much, Robert Linde, for sharing your valuable time and knowledge with us today. So I encourage all prospective students and practitioners to grab this opportunity to learn from the expertise of Robert Linde. And as a reminder, Robert Linde will be teaching unique herbal medicine approaches to orthopedic issue. So this is a live class in Fort Lauderdale Beach during FASOMA 3 days conference. So the date and time of this class is gonna be Friday, August 25th at 2 p.m. So the CEU category for this is general with 3 credits. So I hope to see everybody there, and we shall see you there. Thank you so much, Robert Linde, and see you there.
All right. Thank you so much. I look forward to seeing everybody there in just a few months.
Yes, absolutely. Thank you.
All right.